Hello, my name is Dr. Brian Reid, and I'm a naturopathic doctor. And this is a video in response to a question on one of my posts about whether I have any concerns about herbs potentially being overstimulating for the immune system, particularly if a person had, say, an autoimmune condition. It's a really good question. That's something that's definitely talked about around different herbs, because especially when herbs are described as being, stimulating for the immune system or supporting for the immune system, activating the immune system, that type of thing, sounds really good. This conversations usually in the context of helping to get rid of, either acute or chronic viruses or bacterial infections or things like that. And it's like, of course, we want to stimulate the heck out of that immune system so it's, taking out all the bad guys or the things that you don't want to be there really efficiently. But the folks who have, say, autoimmune conditions where they're thinking like, wait a minute, my immune system is overacting in some ways. I don't want to overstimulate it and potentially cause problems. That's a really good question to raise. There are some studies suggesting that certain herbs can potentially overstimulate parts of the immune system that could potentially make autoimmune conditions worse. The immune system's really complicated, and so just talking about stimulating quote unquote the immune system is very broad. There are different branches of the immune system, and so it's really about not wanting to overstimulate the parts of the immune system that might drive more inflammation or other factors that influence pain levels in a person's system. If say the wrong, you don't want to drive up those factors that could potentially drive more symptoms, of course. In clinical practice, I've seen that generally speaking, the herbs that I work with, primarily when I'm helping patients who are dealing with chronic forms of borreliosis, which is sometimes referred to as chronic Lyme disease, co-infections, viruses, things like that. I found that the majority of herbs, sorry, pardon me, little something in my throat there. I have found that the majority of patients that I've worked with who are working with those herbs have not had any issues with their autoimmune symptoms flaring up. There are certain cases where I've definitely been treading very lightly, folks who aren't being, their symptoms aren't being well managed with medication, or patients who are, are quite sensitive. I certainly am cautious, more cautious with those patients. But what I found is that by and large, the herbs that I generally recommend don't seem to have an aggravating effect on the pathophysiology of patients who have been diagnosed with certain autoimmune conditions. To the contrary, what I have found is that a number of the patients that I've worked with who are dealing with different types of autoimmune conditions, whether it's rheumatoid arthritis or ankylosing spondylitis, or it's MS or what have you, psoriasis, then I found that by and large, in not only are the herbs generally well tolerated, but that in many cases, those symptoms tend to get better, and sometimes we see reduced levels of autoimmune, like indicators of autoimmune antibodies and things like that. So I found them to be very well tolerated. And that being said, it has to be taken case by case, and I certainly highly recommend that anyone who's been diagnosed with an autoimmune condition, make sure that you speak to your personal health authority before working with herbs that, really working with anything. Ideally talk to your healthcare provider first, but you certainly want to be exercising some caution, because there is sort of that potential concern. But in practice, it's not really something that I've seen be a significant issue. So I hope that information is helpful. If anybody has any questions about this topic or anything else, just post a comment in the comment section below, and I'm happy to answer questions I'll answer the questions if I know the answer, or think I have a good crack at the answer. So feel free to post below.